Hi everyone. I want to talk about anxiety. Now, I think there's probably four basic ways you have anxiety. One is it's genuine anxiety. Anxiety is a protective mechanism. So, somebody's threatening you with a knife or a gun. You have this release of norepinephrine, this fight or flight response, and that's normal. It's protective. Then you can have a rather significant injury to the limbic system in the brain and have intense anxiety. This might happen with an explosion, for instance, like in combat. That can do that. Another source of abnormal anxiety is when people have, I've talked about this before, they have autonomic dysfunction and really low blood pressure to the head. And the nervous system, in trying to normalize pressure, and that would improve oxygen delivery, the body will release norepinephrine. Norepinephrine will drive pressure to your head. This is your fight or flight hormone, okay? And so you can feel anxious with that. And that might occur, people will, if they're sitting in a car too long, say sitting still and the pressure's dropping, or they haven't eaten in a good while and their pressure's dropping, or sometimes you get too hot and that'll make your pressure drop, or social circumstances, a lot of pressure, that'll make your pressure drop. And normally it shouldn't do that, but it's only will do that if you have autonomic damage. Okay, so that's the third way. And the fourth way, let's say 5 ways. There's a fourth way, might be just a side effect from a medicine. We'll get that out of the way. And the way I want to talk about, though, is imbalance of intestinal bacteria. That alone can cause intense anxiety. All right. Now, what you can see here is my little graphic with stomach, flows into the small intestine, into the large intestine. And we have particular bacteria up here in the small intestine, represented by these families, and then you get these families living down in here. Now, this is the normal setup, but if you end up with overgrowth, so you have 1 or 2 species living up here, can cause intense anxiety, just that alone. And I've had many patients where, that's the overriding thing, and they take, say, 10 days of rifaximin, and it just vanishes. Now, is that typical patient? No. People with bad anxiety, it's typically part of it. They'll say they can take rifaximin, and they might say, 20%, 50% of my anxiety was gone after 10 days of rifaximin. They still get this other stuff, so they may have it from another cause, like autonomic dysfunction and that low blood pressure, okay? But a big part of it comes from here. And what they've understood in small mammals, so like mice are naturally afraid of cats. So mice get anxious when they're around cats, okay? They release norepinephrine. And what they found is if you go in and you remove all the bacteria in a mouse, they will lose fear of cats in like a week or two. And they've shown the same thing with prairie dogs, rats, and voles. Okay, so the more different mammals they show that in, it can affect us too. And it's probably this mammal as well. So we have some evidence that this bacteria are part of this kind of mechanism. And what they've shown, if you take a mouse and you can artificially make a mouse like this, where you have bacterial overgrowth like we do, these mice are producing tons of norepinephrine, and they're just a hot mess. So we even see it in the animal models. All right. So really, main things, aside from a drug making you anxious, it could be normal. It could be damage to the limbic system, and that's a pretty severe brain injury. Okay. It could be from low blood pressure. All right. Now the low blood pressure stuff, if you lay down for 15 minutes, it helps you calm down because you have blood pressure to your head. All right, and then the other main one can be just from the bacterial overgrowth, which inulin can help a lot, as well as the rifaximin. So I hope that's helpful to everybody. Otherwise, you have a great day. Bye.